Hi there. I don't really know why patients have orthodontic treatment. Now that sounds nuts, but we know within the orthodontic community that we don't do masses to improve people's dental health. Maybe we can make teeth a bit easy to clean, but really you can still clean them even if they're a bit wonky. Maybe we can reduce the risk of trauma by reducing overjets in patients of certain ages. But for the most part, it's about making the teeth straighter so they look nicer. But yet, why do we get to do it so much? Because a lot of the reason that patients come to see us is not purely about vanity, that they want to just look better. It's something a little bit more than that, and I haven't really worked it out. I haven't really managed to kind of get into that kind of mindset until now, because I had a bit of a thought over the last week. So I didn't do a blog last week, and I didn't do a blog for two reasons. The first of those is it was my birthday. And the second of those was that I had a bright red spot on my nose. I looked like Rudolph. And that may not sound like a good reason not to do something. And it isn't. But it stopped me. It stopped me having the motivation to get off my chair and stand up and record something into a camera like this. And now the spot's gone, I'm back, and I have that motivation. So that 1% shift, actually, does that mean something for orthodontic patients? Because if the analogy is that the pimple is like having teeth that aren't straight, then they have to deal with that every day. In other words, the effort that it takes to engage and to do the thing that somebody who didn't have those concerns would do without any hesitation, that little bit of extra effort, that little bit of extra give, means that there's a chance that they feel less willing to engage into those social settings or work settings and to smile and engage in a completely unencumbered fashion, because for them it feels like they've got the metaphorical spot on the end of their nose every day of their lives. And for some people it's going to feel like a bigger thing than others, but even if it only has a tiny impact, that can make a difference. So as I go back into work tomorrow and start to think about why I do what I do and what the real benefit might be, I'm actually going to feel a bit more comfortable about it, because for the first time I'm going to be thinking, well, if I can just shift the dial slightly so that when this patient or that patient comes into a setting where previously they may have felt slightly restrained or understated, or maybe even avoid that situation, they're going to do that with more confidence, with less resistance than they would ever do before. So my spot taught me something. Firstly, it taught me you're never too old to get spots on your nose, particularly when you're wearing masks. But secondly, it, I think for the first time, showed me that the work that we do makes a difference, not in terms of dental health, but in terms of how people feel and how people engage with the wider world around them. And for them, that can be a huge, important, life-changing event. So, share, comment, likes, super appreciated. Provided I don't have a spot, I'll be back next week. Thank you for watching.